Good evening, everyone, and thanks so much for joining us again tonight for the second part of our Exercise is Medicine webinar. If you happen to miss the first part, it's available as a recording on our website. Tonight's webinar will also be recorded and should be available on the PHN website, hopefully by Friday. I'm Liz Robinson, Education Coordinator with the Western PHN, and tonight's presenter is Madeline Conyers. Hopefully you've had a chance to read her bio there. We'll start tonight with an acknowledgement of country. The Western New South Wales Primary Health Network acknowledges that we work on the traditional lands of many Aboriginal clans, tribes and nations. I'd like to pay respect to elders past, present and emerging, and acknowledge the traditional custodians who care for this land on which we work and live. I acknowledge and respect their continuing culture and the contribution they make to the life of the communities in our region. As I said, these webinars are being recorded and will be on our website for you to access. If you attend the second part, which hopefully you are tonight, you'll get a survey sent out to you to complete, and that should come out to you by email tomorrow. There'll also be a QR code to scan at the end of tonight's presentation for a quick and easy way to get to the evaluation. The controls. If you haven't used GoToWebinar before, there's a grab bar. And if you can't see the big control panel, just click on the small orange arrow, which is at the top right-hand side of your screen. And that should open up the control panel. Everyone's in listen-only mode to optimise the sound quality. So if you have a question, please use the questions box and Maddie will respond as we go through the webinar. Just click on the small triangle to open up the questions box to type your questions in. And please, if you're having any trouble with your audio or joining in, please use the questions box to ask for help rather than the raise your hand icon. Otherwise, we won't be able to respond to you. I'll just hand over to Maddie now.
All right, I think we're good to go. So my name is Maddie and I'm going to be doing the part 2 of the webinar tonight. So we'll start off with the rebates. So to come and see an exercise physiologist, some of your patients may be able to access rebates. Most of our clients that are referred through the GPs come through on Medicare, so the 5-session chronic disease management plan. So these are patients that have chronic conditions or have type 2 diabetes and need to be referred by the GP. They are entitled to 5 visits in the year, but if they have diabetes, they are entitled to another 8 plus an initial, so they also get the 5 plus the 9 within that year. And within our clinic, we do charge a small gap fee for clients who do not have a concession. Clients that do have concessions, they are bulk billed, but it's not always explained to our clients that they think sometimes that this is going to be a free service. And then we also get clients through DVA. So that is a 12-session treatment cycle. So after the referral, we send off for the access to the 12 sessions, and coming towards the end, we kind of gauge how they've gone from the start to the end and then request another 12 if needed. We also see clients through work cover and CTB through the rebates. Clients can come and see us without a referral as well, and they can sometimes access a rebate through their private health fund. Not all of the health funds are eligible, so that's something they would have to look into. And we also see the NDIS clients. So they are either self-managed or plan-managed, and a few type of clients that come to see exercise physiologists through NDIS are amputees, cerebral palsy, clients with intellectual disabilities, clients that have had strokes, that have MS or other neurological conditions. And then just a little report that was done in 2016, just showing that Australians living with chronic conditions, they could save up to $5,938 per year. And it also showed that for every dollar spent on exercise physiologist interventions, you could get $10.50 in improved health, productivity, and reduced out-of-pocket expenses. So the next slide, let's to work. So accredited exercise scientists, at the moment, they do not have any rebates available to them. So they are also allied health professionals, and they, as Shannon explained last week, they have to undertake a 3-university course to complete their study. They're also working with patients in the prevention of chronic conditions. They usually work with lower risk patients. How do you find an exercise physiologist or an exercise scientist? So ESSA has this great function here. So you can search it by this link that showed. So if you need an exercise physiologist within your area, you can go onto this website. You can type in the specific chronic condition that you are looking for, and it will bring up with an exercise physiologist or exercise scientist that may specialize in this area. If you need an exercise physiologist or exercise scientist that speaks in a different language, if your client doesn't speak English, you also have access to this. But I would also ask your colleagues that you work with if they have worked with an exercise physiologist or exercise scientist before, as they might have a good recommendation for your client. And just to note that you don't need to enter all these search items, so mainly just your postcode, and that will bring up the closest exercise physiologist or scientist to you. Okay, and then we have a little quiz. So I think to do this one, maybe can you guys just type into the chat box? Is that something that we can do for the answers?
We should be able to, Maddie, yep.
Yep, okay, so we'll start with question 1. So if you guys just want to type in true or false in the box. So the first question is, exercise is not recommended in cases of patients with high risk falls.
Got a few answers coming through.
Yeah. Can I see any of them?
I can read them out to you. We've got 6 falses, 7 falses.
Yep. They're all wrong.
Ah.
So we definitely can recommend exercises for your clients that are high risk falls. Just because they have maybe using a walker to get around doesn't mean that we can't come in and assess them. We can always start with seated exercises. So they may seem like simple exercises for us, but for people that have low balance and people that have low muscle strength in their lower limbs, this is something that definitely over time, which is, if it's done repetitively, can help build up the strength in these areas and help to prevent future falls. So if we were to send them home with these exercises, they would be performed either in a sitting position or with safety rails around them, and just making sure that someone was there if they were standing up and doing those exercises. And then question number 2. So patients with the chronic disease management plan, so how many services are they entitled to in the calendar year? And then if you just want to read out those answers for me too.
Through. Yep. Most people are saying 5.
Yep, that is
Couple more
correct.
coming through with 5.
Yeah, so it's the 5. Question number 2. So if they can type in either A or B, or if they know both, they can do both. So how many minutes of physical activity should adults accumulate per week? And those were, Shannon presented those slides last week. So if you can remember to back then type your answer in the question box.
We've got some people saying 150 minutes, some people saying moderate intensity, 75 minutes for B.
Yep.
120.
So it's so each week for moderate, it's 150 to 300 minutes. And the moderate exercise again, which would be your brisk walking. And then for the vigorous, it's 75 to 150 minutes per week, which is your higher intensity exercise like jogging. And then question number 4. Low fitness is a major risk factor for early death. So just true or false again.
Mostly trues coming in there, Manny.
Yep. So Shannon went over that slide again last week, which went over the graph and it showed the effects of low cardiorespiratory fitness on mortality. So that was if you weren't exercising, then you were at higher risk of developing chronic conditions.
We just had someone mention that those rebated services you could get an extra 3 with group assessment if diabetic.
Yeah. So moving on to the next slide. So it's exercise is medicine in practice. This is an action guide. So it's a brief intervention system which provides healthcare professionals with tools and resources that they need to start the conversation about physical activity. And it ultimately enables patients' behavioural change. So it's just a little framework for you guys. If you only have a minute within your consultation, if you're a bit pressed for time, then you can start at step 1 and then finish with step 5, missing step 2, 3, and 4. So step 1 is asking, so just asking the patient and recording how many minutes of exercise they do during the week, the intensity of the exercise that they do, and just briefly jotting that one down. And then based on the answers, you can provide them with information, so up-to-date evidence-based information. There is numerous fact sheets that are available on the Exercise is Medicine website for each specific chronic condition. And these fact sheets you can just print off and provide to your patients. If you guys aren't so pressed for time during your consult, you can go through and do the 5 steps. So after asking how many minutes of physical activity they do per week, you can screen them. So when we screen our clients, we use the exercise, the ESSA pre-screening tool, which is available on their website. And this is just a 7 yes or no question asking a little bit about their health. So if they answer no to all these questions, then they can begin light to moderate activity. You can refer them on to an exercise physiologist or scientist. If they answer yes to any of the questions, they may need to be cleared for exercise, but you can use your professional judgment to decide if the chronic condition and if they're able to begin exercise independently, or whether or not you think they would need the supervision of an EP. And then to step number 3, so customizing your advice. So this is based on the client's willingness to undertake an exercise program. So you may need to refer them on to a professional so that they are encouraged and they stay on track to start an exercise program. Step number 4, if you refer effectively, so if you refer to other allied health and to exercise physiologists, you can ensure the exercise prescribed to them is safe and effective based on their condition. And then step number 5 is providing the information to them. So I don't know how long you spend in your consults with them, but there's 2 different ways that you can just quickly add in exercise and the benefits of it into your consult. So the next slide is exercise, which is the 5th vital sign. So how can you clinically measure physical activity? So you can ask them, as said before, how many days per week they exercise and whether or not it's moderate or vigorous, how many minutes they engage in exercise, and this only takes 1 minute to administer, and you can just jot that down in their notes and pass it on. And then we use best practice in our clinic. So it has a physical activity assessment tool if you weren't aware, and this can help you access and track your patients' activity levels over time. And then 2, this is just a slide showing how you would get into there. So clicking on the clinical, going down to physical activity prescription, and then you would open up the patient's record, click on the red running man, and then you can click on the assessment and record their new physical activity. This would be something that was really helpful if you were sharing a space with EPs and other allied health professionals. That way they can, if they're seeing a client, they can go into the information and just have a quick look over before they have the assessment with them, and it will just give them an indicator of where they're at the moment. So engaging your patient. So interventions that present with increased barriers and compliance issues like exercise require counselling strategies to engage the patients for better self-management. So there is a physical activity stage of change assessment tool. So this outlines the strategies that can be used with patients to promote sustainable behavioural change. As we know, when we have our clients in, not all of them are willing and ready to begin in exercise, as some of them do see it as more of a chore. Okay, so these are little conversation starters that you can have with your clients when you have them in the consults. So if you do have the time, then you can get a gauge of your patient's understanding of the benefits of exercise, the impacts it can have on their specific chronic conditions, and asking them the effects on their health if they continue without change. So, for example, if they're just going to sit around and do nothing after they have maybe been diagnosed with type 2 diabetes or hypertension, do they know what the risk factors are if they keep going the way that they're going? Okay, and then busting the myth. So needing a gym to get fit. This is absolutely something that we don't need to do. There are many ways that we can complete exercise. We can do it at home, body weight exercises, could go for a walk. Too old to begin structured physical activity. We're definitely never too old to start exercising, even if we're just starting slow and building up from there. And you're needing to use sophisticated equipment to perform strength training. No, you definitely don't need that. So during coronavirus, we've kind of had to adapt and do some online Zoom sessions, and we've kind of just been getting the patients to use what they have lying around their home. So it could just be starting with a tin of canned tomatoes, and they can be using them. It could be filling up a backpack with books and using them to do squats. There's so many other ways that they can do. They definitely don't need to go to a gym and use all the fancy machines. So I don't know if you guys have any kind of excuses that you have had from your patients before. You just want to type it into the box if you've ever asked them.
They must have the best patients in the world, Maddie.
Yeah.
So we don't have just one response saying nil. All very well behaved patients.
Very good. Yeah, so you definitely do not need the gym to get fit. So on to the next
Just
one.
had a comment from Susan that it's a myth that exercise has to hurt or be time consuming.
Yeah, so you can easily just start with your 5 minutes a day and build up from there. So you could do 5 minutes in the morning, 5 minutes in the afternoon. It's better than doing nothing.
And another comment from Helen that some people have said that they're too sore after the first session to keep going.
Now, that's generally the way that it works, but if you keep doing something, you'll find that that soreness will start easing and you'll start getting stronger and feeling fitter. Okay, moving on to the next slide. So providing options. So if you can provide them with fact sheets, provide them with advice via specific fact sheets. So you can always tell them to start with just 5 minutes per day and go from there. There's specific exercise prescription. So that's just telling them to go for a walk, or if you have a greater understanding of their chronic condition and what kind of exercise is best for them, you can also just tell them to start doing that. And if you don't think they're going to participate in one, you can always refer them on to see us. The next slide is, so if they're non-receptive and resistance towards exercise, so you can provide them with a brief information, personalized message regarding the benefits of physical activity. So you can just print off, provide them with fact sheets. So educating them with the benefits of taking a brief walk each day, so they can also track this. They don't have to go out and buy a pedometer. I know on the iPhone there is a health app, and if you have your phone with you when you're walking, that records your steps. I'm not too sure if Androids have the same or similar feature. So doing any physical activity is better than doing none at all. So like I said before, even if it's just 10, 15 minutes a day, it's better than not doing it. And so moving from sedentary to low levels can definitely have the benefits. And again, starting from the 5 minutes and working up from there. So if you guys need any further information on finding exercise physiologist, if you need any further information on the chronic conditions and the fact sheets, you can head to the Exercise is Medicine website, and they also have an email that you can contact with them if you have any direct questions that you can't find on the website. So that's all the slides there today. Got through them a bit faster than I thought, but we do have our contact information there for Shannon and myself. So if you have any specific questions that you wanted to direct at us, you can ask us now, or if you think of anything later, then you can contact us via our email or phone. And we are located up in the Oka Health Medical Centre. And that is your QR code there. But if you guys have any questions about any of the information tonight, then you can send them through and we can go over them now.
I do have a question from Cho, Maddie. How do we do isometric exercise?
Isometric exercise. So an isometric exercise is an exercise where the muscle length doesn't change. So that's something that we would give to our high risk fall patients, something similar like that. So an easy one to do is if you were just to do a wall squat and try and hold that one for as long as you can. Another one that you can do is a seated hip adduction. So if you guys are sitting in your chairs now, and if you press on the outside of your knees and you push your knees against your hands, then that is also an isometric exercise. Holding a plank also.
Oh, sorry, Maddie.
Yeah, and holding a plank is also an isometric exercise.
Anyone else have any other questions? All right, Maddie, is there anything else that you wanted to add?
No, I think that's it. Maybe just going over the Medicare, and when they do explain to their clients about the five sessions that they get, that sometimes it may incur a cost for them. Because yes, sometimes we ring up our clients and then we tell them how much they are. So for our initial assessment, we charge $90, and then everyone after that is $85, but they get the $52 rebate back from the government. But even some of our clients, they find this quite a big cost, and then they don't end up uptaking the service. So maybe explaining that to them, and if they actually do want to uptake the service. Otherwise, it's just wasting their time and it's wasting our time.
We do have another question from Cho. For someone with a BMI of 45 who has knee pain, is isometric exercise helpful?
It depends on the type of knee pain. So they will probably just start. So they can do lots of other things. If their knee pain is something that hurts a lot when they exercise, they can do cycling on the bike. They can do the arm ergometer, which is the cycling with your hands. But yes, we generally start with isometric exercises and then move them into the harder exercises after that. But I probably wouldn't, if they had a BMI of 45, I wouldn't give them a wall squat to start with, because that's a lot of weight that they would have to
Jo
start
also
with.
wants
Yes.
to know if there's any suitable non-weight bearing exercises without needing a swimming pool, without having access to a swimming pool, perhaps.
So, like seated exercises, the ones that they can still do on land. So there's lots of ones that they can do. So they could do seated marching. They could do a lot of stuff with seated band work. They could do seated rope work. There's plenty of stuff that they can do, but that also depends on what access they have and what stuff they have at home.
Jo sends through his thanks for that, answering that question. Thanks, Maddie. Does anyone else have any other questions? So if no one else has got anything that they want to ask, we might finish up there tonight. As I said, tonight's session and last week's are recorded and going to be available on the website. So please take a scan of that QR code with your phone to access the evaluation, but we will be also sending out an email tomorrow with a link to the evaluation as well, and some other helpful information that Shannon and Maddie will put together for us. So thanks everyone for coming tonight, and have a good evening. Thank you, Maddie.
No worries. Thank you. Bye.
Bye.